Morning, we're talking about efforts to combat substance abuse here in Connecticut. It's still a big thing, even though opioid addiction and loss of life has kind of taken a little bit of a backseat over the last couple of years to COVID. We're going to address that. But according to the state's Department of Public Health, between January and May this year, 423 people died of an overdose. And that's just here in Connecticut. 86% of those deaths being linked to fentanyl. One organization, Demand Zero, working to prevent these deaths from happening. I want you to meet Lisa Deane, who's going to talk about a walk that we have coming up this weekend, but also a personal story, and it involves your son. Tell me about him.
Well, my son, Joe Deane, was 23 when he died of a fentanyl poisoning back in 2018. He was extremely funny, a gifted athlete, loved family above all else, and his beautiful girlfriend, Tori. And unfortunately, he had a substance use disorder, and he was addicted to heroin.
But he, for a while there, he had been recovering and kind of fell into it accidentally at the end. Is that right?
That's right. Yeah. He had been sober for months and worked very, very hard on his sobriety for years, actually.
Right.
We thought this was it. We thought we had it. Purchased some drugs in New Haven, which he thought was heroin. Unfortunately, one of the bags that he injected was pure fentanyl.
Wow.
Yeah.
I'm sorry to hear that, but if you notice,
thank you.
There's just a little glimmer of a smile on your face when you were telling the story, because in the efforts to help combat this. It may be too late for your son, but it's not too late for the state. We were talking earlier about how the headlines have taken a little bit of a backseat to COVID, but you know from your efforts that fentanyl addiction, opioid addiction is still a major problem here in Connecticut and throughout the U.S.
It's a dire situation here. And I know you had that stat of over 400. I just got the new stat, and we're over 600 right now.
Go, which is not a good number.
No, it's a horrific number, and it should be on the forefront of everyone's minds. Right. We've got a major fentanyl problem in our state as well as the United States. 107,000 died last year.
Let's talk about what you're doing this weekend, and then we'll tie it all together. It's more than just a personal connection for you. Have a walk going on, part of a movement that you started, but going on in New Haven this weekend.
Right. This weekend is National Fentanyl Prevention and Awareness Day. So we're going to honor that day by having a walk in New Haven. We'll start at City Hall. It'll be about a half-hour walk, and then we'll end up at a nice air-conditioned facility and have some, because it's going to be hot.
Right.
I've been listening to you.
Oh, well, thank you.
Yeah. So we'll end up at a nice facility, and we'll hear some really important messages from dignitaries around the state of Connecticut.
Right. 10 o'clock Saturday morning, and you're going to get a lot of people because the weather is going to be nice. When you meet other parents there, and I imagine you would, what do you tell them? What kind of message do you send?
The biggest one is sobriety is achievable. There are resources out there. But I also tell them, and I want everyone to know because it's imperative, that we teach and educate all children and adults about the dangers of counterfeit pills. They're out there. Don't take anything unless your name is on the vial.
It's more than just saying don't do drugs.
That's right.
Just
Absolutely.
saying no only takes you so far. Lisa Deane, I hate that you're here because of what you went through, but it's like I said, it's nice to see that you are doing so much good. We'll link you to Demand Zero and their organization on our website, fox61.com. Let's go back into the studio. Erica Arias.